Today I'm going to talk about recurrent UTI infection and its best treatment in Ayurveda. UTI may seem to be a very simple problem that you have a lot of symptoms, you take an antibiotic, it gets resolved. But there are a number of people that have recurrent UTI. The pain, burning, the discomfort that it has comes back over and over again. It really frustrates the patient, the same investigation, same symptoms, the same pus cells increasing, the same medications, antibiotics, the same niftacetal gets relieved, comes back again every 1, 3, 6 months periodically. So this video will help you understand and rule out, eliminate the root cause using certain home remedies that I'll be sharing in this video, certain combinations and Ayurveda protocol for a better understanding on how Ayurveda treats this recurrent UTI right from the root cause. Let's understand in this video. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. UTI can affect anyone. It is more common in women compared to men. It is basically infection of the ureter, urethra, kidney and the urinary bladder. It is generally caused because of a bacteria that enters in the urinary bladder through urethra. What is UTI? It is generally because of a bacteria that enters in the urinary tract through urethra. From the tract, it can further travel or migrate in the ureter, it can go in the urinary bladder, it can go in the kidney and cause infection. So basically it is more common in women compared to men because of two common reasons. Number one is the short distance between the urethral opening and the anus. Second is the short length of the urethra, because of which the bacteria can easily travel and enter in the urinary bladder and it causes the respective symptoms. There is a lot of pain, burning, discomfort, difficulty in urinating. There is fever with chills. There is even nausea, vomiting in severe cases. The condition gets worse if a medication is not taken. So emergency treatment, right treatment is very, very important to rule out that state, that phase. A lot of patients have recurrent UTI infection. The same urine analysis, the same pus cell increases, the same antibiotics taken gets resolved. So in Ayurveda, it is commonly said as Mutra Krucha. It happens because of two dosh getting elevated, the Vat and the Pitta. So we commonly see two kinds of patients, majorly Pitta Pradhan Vat patients and in some cases Vat Pradhan Pitta patients. Since it is the sthan of Vat and it is a symptom of Pitta, Vat Pitta or Pitta Vat treatment has to be given. An Ayurveda physician diagnoses the patient as per their dosh, as per their complaints and advises the correct treatment as per the diagnosis, which is Pitta Pradhan Vat or Vat Pradhan Pitta. Do's and don'ts is advised generally yogurt, sour items, kiwi, dragon, mosambi, everything that is sour in its taste is avoided. A Kapha Shamak diet, sweet, sour, salty, needs to be reduced. Such kind of a diet is given advice to the patient. Let's first talk about the best combination that we advise to patients of recurrent UTI. It has 5 ingredients: ashwagandha, avla, ginger, guduchi and gokshur. 5 ingredients, take 5 grams of each of this and mix it in 200 ml of water. Boil it for some time until 50 ml liquid is left over. So boil it, keep the lid open so it becomes light to digest. If you keep the lid closed, it becomes heavy to digest. So strain the liquid once 50 ml is remaining and consume around 20 to 25 ml 2 times a day. This is generally the best diuretic. It removes infections, gives strength to the urinary bladder. It removes the toxins. Gokshur is the best, Mutra Shodhak, Garbhashay Shodhak Aushad. It is the Balya and Rasayan Aushad. Ashwagandha is a great antioxidant. Guduchi is a Medhya Uttam brain tonic. So these 5 combinations work best when it comes to recurrent UTI infection. In a lot of awareness campaigns, we've advised patients with these 5 remedies and it helps a lot. Apart from this, there are herbs right from Ushir to Chandan to Truna Panchamol to Laghu Panchamol to combinations that help best when it comes to recurrent UTI. There are even more potent medications like the Vanga Bhasma, like the Spatik Bhasma, like the Trivanga Bhasma, which helps when it comes to recurrent UTI. There are even better protocols to rule out the recurrent UTI right from the Dhanyak Gokshur Siddh Matra Basti. There is the medicated ghee where the medicine is Dhanyak as well as Gokshur. So we combine it, make a medicated ghee and we use it in the in the medium of Matra Basti, which is medicated enema advised at home. It is Virechan, which is medicated purgation, where all the pith is collected in your GI tract and from there it is flushed out of the system. There is Basti, Nasya, Virechan and certain medications along with do's and don'ts that helps patients in treating the recurrent UTI. In simple words, the pitta, the inflammation has to be reduced. We generally put the patient on Dhanyak Siddha Heem, which is to soak 4 teaspoons of dhania, which is coriander seeds. Soak it 4 teaspoons in 1 liter of water. Soak it overnight. In the morning, just boil it for around 10 to 15 minutes, then strain this liquid, fill it in a flask, and throughout the day, sip by sip, consume this liquid. It is said as a diuretic. It removes all the toxins out from the urinary tract from the urine. It is said as one of the best Mutra Virechaniya Aushat. All the Mutra Virechan it will do through the urine. So this is one of a point of view that I want to share when it comes to recurrent UTI and Ayurveda. So cause is very important. This was all for now. Any doubts or questions, do let us know in the comment section below. Until next time, from Jyovis and the team, look impressive, be progressive.